Hello everyone and welcome to Inside Healthcare. You know, 5 years ago this month, Barbara Ladd McNamara woke up in a hospital bed and didn't know how she got there. When she first heard news reports of the I-35W bridge collapse, she thought that's what had happened to her. It turns out Barbara had been harboring potentially fatal brain aneurysms without even knowing it. Here's Barbara's story.
Based on the CAT scan, all we knew was that there had been some bleeding around the base of the brain. We had no idea that she had more than one aneurysm at that point.
They probably had a pretty big job ahead of them, but they never made me feel like I was going to die. I remember Dr. Nussbaum just flat out saying, our goal is to get you out of here, to home, and have your life back. And I thought, okay.
An aneurysm is essentially an area of weakness in the wall of one of the blood vessels, one of the arteries bringing blood supply to the brain. And so that area of weakness gradually over time can bulge out and enlarge, much like a balloon that's being inflated, where blood can get into it, swirl around, and come back out. The wall can actually burst and blood can leak out into the space around the brain, and that can be very dangerous. Although we know that a fair number of people actually have aneurysms and aren't aware of them, if an aneurysm does bleed, there's probably a 50% chance that you don't survive. And of the survivors, about half are left with some permanent disability.
He's young, he's brilliant, he has common sense.
They don't do it with the great doctor specialist doing something and then the patient goes over to the great second doctor specialist and the third. They do it all as a team.
From a medical perspective, I think what was really unique about her case was just the sheer number of aneurysms that she had. 13 aneurysms, which is a lot, and represents something of a challenge, to us and to her. I told them that I thought there was a high likelihood that we'd be able to get her through this.
They're beaming when you can say your name. They're just eyes are twinkling.
When somebody comes in and they've had a rupture but they're in good condition, they're talking to us and they're awake and they're able to interact and be part of the discussion, that's the most important thing that we look at. She didn't have any aneurysms located in places that we hadn't successfully treated before. But so we start with a skin incision, then we have to open the skull.
They literally take off a portion or flip back. I don't ask questions like that. But he then put metal clips on 8 of the aneurysms on that side of my head.
We take a titanium clip, which opens and closes like a little clothespin, and that allows us to pinch off the aneurysm, stop the blood flow from getting into it. Blood can't get into it, it can't leak out. The other major way to treat aneurysms is what's called coiling or endovascular treatment. It's the newer treatment, it's less invasive. We'll take a catheter and feed it up from the groin artery all the way up to the carotid arteries or the vertebral artery in the back. The blood vessels represent a highway or give you a roadmap to get up to the aneurysms. Coil, coil, coil. Come up into the aneurysm and fill the aneurysm with platinum wire. They pass an electrical current through that wire and it actually detaches the coil. And that essentially fills it up, and then again, blood can't get into it.
When you can smile, they are ecstatic. They are so supportive.
Emotionally, the people who came to visit her were much more of a wreck than she was. Yeah, she was truly just, there was the courage she showed. She was hanging in there.
She was in an intensive care unit that handles these types of accidents all the time. So to them, they knew exactly what they were doing, but it was very scary to see her. She wakes up and you realize that you're still talking to Barb, that she's still okay, she's still in there.
We all kind of sat and thought, well, what if she was gone? It's like, it would have just changed everything. My little girl said, she's like, but nothing can happen to Grandma. She hasn't taught me how to knit yet. Mm-hmm. It's like.
It's really, humbling to me, the degree to which we've improved and changed the quality of the people's lives afterwards. And, really having a brain aneurysm when I was in training not that long ago was such a devastating diagnosis, and people just accepted that the outcome was not going to be good.
Part of What an amazing, amazing story for Barbara. And joining us is from the National Brain Aneurysm Center is Tess Searsant. Thank you for being with us.
Good
You're
morning.
a clinical nurse specialist. And we had also invited Barbara to be with us, but she's doing so well that she's out busy traveling and was not available. So good for her. It's great to hear that.
Good for her is right.
So, Tess, Barb's story is sort of unusual with the multiple, having 13 aneurysms, but aneurysms in themselves are common. What exactly is an aneurysm and how does it form?
Well, as you saw on the part of Barbara's story, an aneurysm is a weakened part of the blood vessel, and it's specifically on an artery within the brain. And I've got a little picture here I can show. Aneurysms are like a bulge. If you've ever had a weakened tire, a bicycle tire or an inner tube that kind of bulges out. So this is where the main blood flow occurs. But then part of it bulges out because the wall is incorrectly formed. It's not normally formed. So over time, it can bulge out. And we think the reason that these aneurysms form in people is really a combination of genetic factors as well as our own individual environment and risk factors. So we think that people that have aneurysms are born with what we call the propensity or the tendency to have the weakness in their blood vessels. That's not to say that we've been able to identify a gene where we can trace and say, aha, this person is going to have brain aneurysms. We can't do that. We may at some point. But that in combination with risk factors like high blood pressure. So if you think of having a weakened wall plus being high in blood pressure, or add smoking to the mix where there's chemicals and damage to the blood vessels occurring whenever those substances enter the blood and then affect the blood vessels. That's how the aneurysms, we believe, can form. Also, in the brain itself, there's a lot of junctions at certain very critical points.
Like Dr. Nussbaum, he called them highways. Almost.
Right. So then, the highways separate, and at those junctions, or what we call bifurcations, that is a place where more of the aneurysms tend to occur.
Now, in Barbara's case, she had no warning, no symptoms.
No.
Are there symptoms that someone might say, well, this doesn't feel right, or something doesn't feel right?
This could be a brain aneurysm rupturing. I think we have to think about brain aneurysms in two ways. Those that aren't ruptured, which if we're all listening to this, they wouldn't be ruptured, and those like Barbara had. She had one that did rupture.
Only one of the 13 had
Right.
ruptured, and that's what prompted her to, her husband, to call 911.
To call 911. And in that situation with Barbara, when it ruptured, it is technically a type of stroke. And the blood leaked out from that, and she got what many people describe when an aneurysm ruptures, the worst headache of my life. We hear that over and over again. It's a headache not like any other the individual has experienced. For instance, if they've had migraines, it's a different feeling of headache, like a thunderclap within their brain. They may also become very nauseous. They may vomit. The light may bother them, what we call photosensitivity. They may have change in how they interact. They may lose consciousness briefly or not permanently, but that may be part of how they appear before the paramedics arrive. So there is a more suddenness to the symptoms that occur when a person's aneurysm ruptures, as opposed to somebody with an unruptured aneurysm.
Which is similar to the photos we just were looking at, right?
Right, yeah.
Those are unruptured.
These would be unruptured, and
So it's just like a balloon getting bigger and bigger.
right.
Okay.
But sometimes when they do get bigger and bigger, Jody, what happens is they press on structures that are important for how we function. So people sometimes will develop problems with their eyes, or what we call the cranial nerves will be affected. So the lid may droop, A person may develop double vision because their eyes aren't moving synchronously with one another. They may develop a headache. Now, we all get headaches, and so that's difficult to tease out.
What about someone who gets migraines, too?
Well, and that is a challenge.
Some of the things that you were talking about, sensitivity to light, I think a lot of those could be symptoms of migraines as well.
And I think that that's some of the thing that we want to encourage people to get checked out, because you and I can't say, oh, that's a aneurysm, that's a problem in there, but we want to make sure people follow up and investigate and get evaluated by a physician who will be able to do the proper examination, do the scans, and check that out for people.
So if you have some of these symptoms, I mean, when do you call 911? When do you just call and make an appointment to go see your doctor or a specialist like a Dr. Nussbaum?
I think if you're having symptoms that come on suddenly, like Barbara did, it was quite obvious to her husband that she's in trouble. I have to call 911. So her pain was intolerable at that point. She had problems with photosensitivity. The headache was not like none she'd had before, as opposed to some of the other things where we can continue on with our day-to-day life, but it might just be a subtle change in our vision. It's a tricky question you're asking me, though, because we want people to call 911 when there is a sudden onset of symptoms. So if a person is A-okay 1 minute and then changes suddenly, that's the time for the 911 call.
And not to be embarrassed if it turns out to be not, because it could save your life.
Absolutely. We don't want anybody to second guess when it comes to that. In fact, sometimes the problem is people are reluctant to call for help. They don't want to bother the paramedics, or they don't want their neighbors coming out and seeing the whole event happen in their neighborhood. And if the sooner we can get people in for treatment, the better, because we can start managing lots of other things like blood pressure for the individual.
And I would think that's probably more common with women, like saying they don't want to be bothering anyone or something like that.
I don't know if I think that's probably what our instincts tell us. I don't know that we've ever done an exact story or rather study on that. But I think that, yes, we tend as women to say, oh, I'll be okay, or if I keep pushing through, I should be okay. The other thing that's tricky with the headache onset, and we've seen this in some of our people who have come in, they get a headache that is terrible and bad for them, but our pain tolerances are all different. So the person comes into the emergency department, and then it does become a challenge for the team there to look at all the variables, but that's where they have to go, because then you've got the emergency physician looking at that and thinking about that and talking, for instance, to us if they have a question about could this or couldn't be an aneurysm.
In the video, we saw a little bit about the treatment that helped save Barbara's life. What are some of the treatments that we have today? I know that we have a number of them.
Yes, and Dr. Nussbaum mentioned the clipping and the coiling, and he showed pictures of clips, but this gives a little different graphic. With the clipping, that's the procedure that he was describing and Barbara was, where a piece of the skull is taken off after an incision is made, and so the neurosurgeon works from outside the blood vessel to place a clip onto the base of the aneurysm. And they are very tiny clips. I hope that the people seeing this had an appreciation for how teeny tiny they are. But now we have other treatments where what we call interventional neuroradiologists work from inside the blood vessel. So they use tiny, tiny catheters, very soft and pliable, and feed them up from an incision in the groin up into the brain next to the aneurysm and put what we call the coils in there. And the coils are made, I've got a little picture here, there's different kinds, but they're made out of platinum, and they're very, very soft, like just a couple of hairs that come together. And the interventional neuroradiologist figures out which of these coils to put in and how much of them. And if you can see here, just for a
how
little bit
small it
better
is.
picture, right on the end of this, you can see the coil itself. And it's really soft. Let's see if I can balance this better. It's really, really soft. And if I put it into your hand, you might not be able to feel it in the palm of your hand. So it's extremely pliable. It's not like we're pushing wire in there. And then what the interventional neuroradiologist does is pack the aneurysm so that it doesn't bleed anymore. So we're really stabilizing that aneurysm. So we have a couple of different ways mainly that we do it. Now with the big aneurysms, like you saw in the picture I showed, what we call giant aneurysms, or ones that bulge out around the whole blood vessel, we sometimes have to use what we call bypass surgery, and that is a little bit more involved for the individual.
And the National Brain Aneurysm Center at St. Joe's is one of the handful of places in the country that does this. Why don't you tell us a little bit about that?
Yes.
Why it must be extremely delicate or difficult.
Oh, it's very delicate, and it's one where if we went and tried to put a clip, you know, like the little clothespin thing here or here, it might not be the right thing for the patient. And so we have to look at this carefully. And so with a bypass, if we can't do clipping or coiling, what we're doing is rerouting or redirecting the blood. So blood is flowing through here to important parts of the brain, and if we cut this off, we would be causing something devastating potentially for the person. So what Dr. Nussbaum will do is he'll take a blood vessel from a different part of the body and attach it in a different place. It's kind of like a detour, or adding in more of the blood flow to the parts of the brain that need it, and then he's able to go in and just seal this off.
Wow.
And I'm simplifying it, but that's that's essentially what happens. So then this won't give the person trouble anymore, but the blood is still getting to the parts of the brain that need it and can function normally.
What are some of the, obviously being so delicate like that, death I think would be a potential risk.
Certainly.
And
certainly.
maybe debilitating if it cuts off that whole area or something, that
Yes.
blood supply.
Yeah, but I'll tell you what, with the careful planning that our doctors do with Dr. Nussbaum and Dr. Madison and his colleagues, they look at these things, and with the technology that we have now, Jody, with the imaging that we have, they can plan so much better than previously. You know, in the old days, actually, this kind of clipping surgery has been going on since 1937.
Wow.
Yeah, yeah. And
Different type of materials, obviously.
Definitely so. Well, the coiling has been since about the 1990s.
Wow.
So that's a much newer technology, but with the ability to take the images that we have now, the physicians can plan so much better than they've been able to. So with the brain bypass surgery, Dr. Nussbaum can see exactly what he needs to do, and I think that really minimizes the risk to the person during the procedure.
You know, and unfortunately for Barb too, she went to the National Brain Aneurysm Center at St. Joe's, which is one of the top facilities in the country. Why don't you tell us about it?
Certainly. We're proud of our program, and we started putting things together back in about 2001, 2002, and we've got skilled physicians. I think Dr. Nussbaum speaks for himself when you hear him talk about what he does. But he has such a depth of expertise. He has treated, I think he told me last time I asked, over 2,000 aneurysms that he personally has clipped. He said he stopped counting after that, and that was a few years ago.
Seems like all the research I read too, they say if you need something like that, you want to go to a place that does a lot of the procedures.
Sure. Yeah, I mean, you want the experienced person. You want somebody who's done hundreds, if not thousands, versus somebody that does it once or twice a year. So you're in good hands when you're with him. On the endovascular or interventional neuroradiology side, we have Dr. Mike Madison and his colleagues. And Dr. Madison and Dr. Nussbaum have been working together for many, many years. And I think that their expertise in the treatment phase also extends into the impact they've had on the team then that takes care of the patient after they come out of the operating room to our intensive care unit. So we have a dedicated neuro-intensive care unit. We have a neurointensive doctors, and they have been specially trained in care of people with neurological problems. We have neuroscience nurses who have had incredible education and have great expertise, and I'm biased because I'm a nurse too, but they're very well educated and can recognize a lot of subtle things that nurses who haven't been exposed in the neuro arena might not necessarily pick up. But our therapists, occupational physical and speech therapy have more exposure. Our pharmacists work more in the neuro arena. Our chaplains, we really come at the person from body, mind, and spirit, thinking of them in all those arenas of life. And that quality of life Dr. Nussbaum mentioned is really, really key. So we try and stay connected with them when we can. We have a support group that we also offer once a month for people and their families, friends.
And you have a book or something that
yes.
goes with it?
And we also have, Dr. Nussbaum has authored a book that is a guide for patients and families, and where he discusses in very understandable language, it's not written in doctor language, but understandable language about brain aneurysms and other kinds of vascular conditions. So we try and offer a lot of resources to people too, because it does take a while to get back into life after they have an experience that is really very profound like this is.
Wow. Before the show too, you were talking a little bit about maybe who's at risk for brain aneurysms. You had mentioned earlier perhaps there could be some people predisposed, but not necessarily men and women, ages. Who's the likely candidate for an aneurysm?
Yeah, from a gender perspective, we see a little bit more in women than men, but that doesn't mean anybody's off the hook, so to speak. Everybody's at risk. We tend to see them more in about the 35 to 60-year-old age range. That's the group where we see them happen most frequently, but that doesn't mean we haven't seen them in younger or older people, definitely. And we're seeing now a little bit more evidence that there is some familial connections, but it's not an automatic family connection. But if we always ask people if they have family members, and if you have two relatives, first-degree relatives, a parent, a sibling, or a child that has had an aneurysm, ruptured or not, we encourage people to get checked out.
Good advice.
Yes. Smoking, high blood pressure, things like other vascular collagen diseases like polycystic kidney disease, those are some of the predisposing
I wouldn't have thought about that. So is there anything you can do to protect yourself against a potential aneurysm?
I think awareness is number one. I think that, because brain aneurysms do represent a small portion of strokes when they rupture, they haven't been thought about very much. So we're trying to increase awareness. That's number one. No family history. I think sometimes you don't know. People are often said to die of natural causes, and that could be a lot of different things. But trying to know your family history can be an important thing. And then looking at those risk factors too that you have in your life. Smoking is definitely one that we know is a contributory factor to aneurysm development. So that's one to stop. And knowing your blood pressure is always good, not only for your brain arteries, but for everywhere in your body. So
Anything related to stress at all by chance?
Well, I think stress, we talk about stress is everywhere and it contributes to many different things, but it can contribute to higher blood pressure. There's a lot of different substances that can be released within our body that contribute to, us having that tense feeling and
fright, flight sort of thing.
That type of thing, Jody. So I think that anytime we can better manage our stress, I think that's going to be a good thing for us, for our health overall.
All great information. You're going to be speaking at a seminar coming up here, a special seminar about aneurysms. If people want to get more information, why don't you tell us about that?
We are having a program on the evening of September 6th. It starts about 6 p.m. with some refreshments, and then at 6:30, Dr. Nussbaum is going to be speaking, and he will talk more in depth about brain aneurysms. And the program runs till about 8 p.m., but we're also going to have a member of our brain aneurysm support group talk about the experience she's had living with brain aneurysms and having them treated. And family members are also going to speak as part of the program. So there'll be opportunity to interact with people who have lived it and are living it. The cost of the program is $10. That includes parking in our St. Joseph's ramp, and it looks to be a very good program. So
And if someone wants to attend, what do they need to?
they can go right to our website, and they can click on register, and that will get them right to the necessary page.
All right, and if they are interested but they're unable to attend your event on the September 6th, where else can they get some more information about aneurysms?
We have a lot of information on our Brain Aneurysm Center.org website, so people can certainly go there. I'm happy if people click on send an email. I'm the one that receives those emails with questions, so I'm happy to get emails and phone calls if people want to contact me. I'm very open to that.
And any question is a reasonable question.
Absolutely. Sometimes people just need to have their fear alleviated, and or something needs clarification, and then they're good to go. So.
Final takeaway advice for our viewers about aneurysms, what would you say?
I would say keep that awareness that they're out there, that that risk factors can be controlled, that in the unfortunate event that something would rupture, that we have very good treatments. But I think we would love it if we could prevent anything from happening. And I think attending to those risk factors is, I think, a good message for people to take home.
Yeah, like in Barbara's case, she didn't even know she was at risk for it.
No.
And I think the first time people find out they do, it's when they're actually experiencing a ruptured aneurysm. So.
Exactly right. Yep.
Well, great advice as always. So thank you, Tess Searson, for being with us from the National Brain Aneurysm Center at St. Joe's Hospital.
Thanks.
It's always a pleasure to have you with us.
Thank you, Jody.
Thanks so much. And we'd like to thank you for joining us. We hope you'll join us next time on Inside Healthcare. We'll see you then, everyone.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.